Hi, everyone. Dr. Oz here at the Centers for Medicare and Medicaid Services. I wish I could join you in person, but I did not want to miss this opportunity to mark World Patient Safety Day with all of you. CMS is guided by a simple premise, one that many of you share. Great societies protect their most vulnerable. We're great people. That's what we're going to do. We're going to show up for folks who are having trouble. In fact, there's a quote from Hubert Humphrey that hangs out in the Great Hall here at HHS headquarters in D.C. It says, I'm going to quote it, "The moral test of government is how that government treats those who are in the dawn of life, the children." I love the metaphor of light here. "Those who are in the twilight of life, the elderly, and those who are in the shadows of life, the sick, the needy, the handicapped." Whether in the dawn, twilight, or shadows of life, patients come first here at CMS. We're committed to delivering exceptional care and fiercely protecting patient safety. I began my career, as many of you know, as a cardiothoracic surgeon. I know medical error can have devastating consequences. You can see it unfolding right in front of you. I know it takes the entire healthcare ecosystem working together to stay diligent and prevent harm. I'm going to share a couple stories from my career. They probably resonate with some of you who have been clinicians. And I'm going to start with the most obvious one, which is in the OR, you have to make sure the patient's ready to leave. And in heart surgery, that means they cannot be exsanguinating blood. Now, hard to tell when you just anticoagulated the patient, done a big operation. I would always rely on my scrub nurses, and Flora in particular, who was the head scrub nurse, was notable because she'd come in and say, no, Dr. Oz, it's not like Sahara Desert. Needs to be like Sahara Desert. Because if there was bleeding happening in places that I didn't appreciate, or because of exhaustion or wishful thinking had gotten wrong, they'd hold me accountable. That's why teams trust each other. They say the truth. Sometimes it's uncomfortable to hear, but it works. I also know for many folks, and this is an important issue for me, having family with you when you're sick means the world. We used to have this rule, many hospitals did, and I was at Columbia University, so it's, typical hospital, high quality, very proud of what we do. But the rule was you didn't really want families in the ICU because people are doing things to the patient in the ICU. But when you're taking care of really sick folks who've had heart transplants, for example, mechanical heart devices, they're there for a while. Not having families visit to me made no sense. I remember distinctly two bookend patients who had both had similar operations. And one of them had the family, the wife, always there, literally reading the newspaper to her, to the fellow, even though he'd had a stroke, and I didn't really think he understood what was going on. In the other, literally catty corner from that gentleman was another patient who'd had a similar operation, and no one ever visited him that I was aware of. He literally melted into the bed. Without the resources of a family to support him, he seemed not to be able to get back in his trajectory towards recovery. The gentleman who was read every day to by his wife walked out of the hospital. And that takes me to the last idea that I always think about, which is our complementary and alternative medicine program, which is bringing things like music and meditation and massage into the hospital to help patients. Why do we do it? Because patients wanted it. And by listening to patients and understanding what would motivate them to get better at a time when they felt a crisis in their life, like open heart surgery, I was able to at least get patients to feel that I was on their team, that I understood what they needed. And I also know doctors have the responsibility to tell their patients what they need to know, even when the truth is painful. Since becoming a CMS administrator, I've been emphasizing some of these painful truths about our healthcare system, about everywhere I go. Now, you know some of these numbers, like, for example, that medical errors are the #3 leading cause of death in the U.S. You know them, but what are we going to do about it? How about maternal mortality rate? One of the worst in the developed world. Yet our healthcare expenditures are growing at 3% faster than our economy. High quality healthcare is the best investment we can make. But bad care is actually the most expensive care because you got to pay the person who did it wrong, pay the person to get it right, and then pay for the complications. So CMS is not going to settle for spending taxpayer dollars on dangerous mistakes. That should never happen. That's throwing good money after bad. It's unethical, it's immoral, and it's foolish. In fact, we're raising the bar this World Patient Safety Day with bold new initiatives to advance patient safety and hold healthcare facilities responsible for causing harm. First, CMS is committed to empowering patients with information and tools that help them become world experts on their health and their body and their own safety. People ought to know a hospital or nursing home's track record before they choose to go over there. We are reinforcing our commitment to safety with new proposed rules that will not allow hospitals with poor safety ratings to receive 5 stars from CMS. We've also defined quality measures to track the most common preventable harms and how often they're occurring in facilities. We're talking about healthcare-acquired conditions, healthcare-associated infections, medication events, maternal mortality and morbidity issues, and of course, diagnostic errors. How can we make the system better? This isn't just about creating more administrative burden for providers. We collect data for these measures digitally, and we can use AI for rapid yet critical analysis of patient harm and then share it. By leveraging powerful technology, we gain a deeper understanding of where and how harm occurs and how to protect patients from it. Now, I want to support and incentivize providers to be the best that they can be, and they crave this goal as well. So let's use technology to do that. Finally, let me leave you with the reality that CMS is engaging with the healthcare ecosystem to sustain a culture of safety. Our quality improvement organizations, we call them QIOs, is going to help champion patient safety across the industry. In their title, it literally says it. They are experts on quality. We're leveraging that expertise and partnering with them and with providers to target problems and improve care. We also want patients and families to be their own champions by making it easier for them to self-report safety issues to our QIOs. Now, a lot of this stuff you probably are going to be talking about, and this is just one day that we celebrate patient safety, but we think about it every day. Many of you have had your lives changed. All of you are critical to the process we're going through, making sure our healthcare ecosystem and our mission to defend patient safety moves aggressively forward. We cannot make it to the finish line without everybody helping and rowing the oars together. So we need your best ideas to seize a generational opportunity to make America healthy again. We are eager to hear your feedback on our initiatives and proposals, and I thank you from the bottom of my heart for your hard work and the efforts to advance patient safety. Please enjoy the rest of the conference, and God bless.